Hi, my name is Jolene Peters. I currently work for Regional Medical Associates, a department of McMaster University. I graduated from Mohawk College 6 years ago. I took the Office Administration Medical program and I fell in love with medical OHIP billing. And that's how I got interested and was intrigued to work with RMA. I was hired right out of college, sorry, and from there I've been there ever since. So, just going to tell you why I've decided to take this course. So, I've decided to take this course because, like I said, I've been with RMA for 6 years. I feel like I'm almost at my limit of what I can learn within this company, and I really do enjoy healthcare. We don't really have a big part in healthcare, but I feel we have a small impact on what we do there at RMA. So that being said, I want to learn more. I want to see how this whole thing works, what the world of healthcare and the hospital and all of that entails. I feel like I only know just a small part of it, and I really want to learn more. So I'm going to talk to you also about accountability with the RMA and how it has similar traits to the research paper accountability and primary healthcare. So as I said, I'm going to refer to the Norton and Kaplan Balanced Scorecard from various Harvard Business Reviews to explain the framework that's involved in processing claims from the Ministry of Health. Sorry, to the Ministry of Health. I'll break it down in the following points. So financial, customer, innovation and learning, and our internal process. So on a financial base, what we do is essentially a percentage of the physician's revenue is charged for RMA services. In addition to these services, RMA also provides data entry, and just because a lot of our physicians aren't really familiar with OHIP billing codes, and that being said, that's why they pay us to make sure that we submit their billing to the ministry, and that's something that they don't have to worry about. Some physicians have the choice of entering billing on their side and then paying us for data entry. This way, if we do it, we are looking out for things that they don't see. So we're trying to maximize their billing in any way we can. With our knowledge, we need to show them how their hard-earned money is going to good use. We try to instill confidence into our physicians so they can trust us 100%. We handle a lot of money, and we need to make sure that they earn the most they can. They work really hard, and we need to work really hard as well. So in terms of work for the customer base, as mentioned, they put their trust in us to make sure that they were doing our jobs correctly and accurately. From their perspective, we know what we're doing, and that is why they have put their trust in us to maximize their revenue. So in addition to patient care, their revenue is the most important to them. Without their revenue to support their departments, patient care will lag. We're employed by our customer, and we assume accountability to increase their revenue with the information we're given. However, the customer, the physician that employs us, is also accountable for the revenue. We're not mind readers. We don't know what happens for each individual case. We're not actually there. So if they don't tell us, then we can't do our jobs correctly. If we're not doing our jobs correctly, then the physician doesn't reach their salary cap, the department becomes low on funds, cuts happen, patients get affected. It's a huge trickle effect. That's why the physician, expects RMA to communicate. We try to keep them informed as much as possible. We do emails, newsletters, meetings, phone calls, accessibility to resources, etc. If they are not well informed, we are not well informed, and we cannot perform to our best ability. And we do try. So the communication is a very big, important thing within RMA and with our customer. However, that being said, I do feel like this can be improved with a better communication channel. RMA doesn't have a website, which I think is very strange. having a website that where our users, our customers, the physician can easily access online resources such as teaching tools, frequently asked questions, feedback, complaints, the communication would be beyond. We would be able to do our job so much better. I wish that's something maybe in the future that RMA will have. Again, it all goes down to money and if we have the proper funding for that. But that's just another situation. I'm just going to talk about the claims processing for that from that matter. So in terms of innovation learning, as everybody knows, medicine is changing, new methods are being created. This is an ever-changing world, not to mention technology. We use a billing software program offered internally and externally to outside users, the physicians. However, this program is very outdated. This program hasn't been updated in over 15 years. I guess it's because if it works, it works. However, like I said, technology is changing. The youth of medicine is arriving. There are more and more youthful doctors out there that are really familiar with the smart technology that we have. Innovation, I would think, is our biggest setback. But you know what? After 15 years, RMA is finally getting a new program. The board has approved funding for these program updates. And like I said earlier, money, that's what it is. It comes down to money. We have to make sure we have the proper funding. And then that again trickles down. And if we have the money to provide better service, the physicians get better revenue, higher revenue, the patient then gets better care. It's like I said, it's a trickle effect. So because the board gave RMA an X amount of money to put towards the reimagination of our program, with a goal and set, multiple meetings, program testing, reporting, etc., our new program will actually be running in 2018. So that's really, really exciting. However, in my opinion, one thing again is lacking from this reimagination. And what I think it is the involvement of our customer, our physician. I think what they should have done initially at the very beginning is involved our customer, asking them what they want from RMA. What do they want from our program? How can we better ourselves and them together? But unfortunately, that's not the way they went. So maybe they didn't have enough money. I'm not really quite sure, but we'll move on from that. In terms of learning, it's going to be a learning curve for everyone. Our internal employees, as well as our outside users, our physicians, there's going to be a little bit of learning curve. But like I said, as long as we communicate to them, they communicate to us, everything should and will go smoothly. In terms of the internal process, we are constantly changing our internal process for the better, almost on a monthly basis. Because in our job, there are a lot of room for error. One small error can cost hundreds or thousands of dollars for a physician. So we try to make everybody accountable that handles each individual piece of paper, because that's how much of a difference it could be, $1 to $1,000 to $100,000. So what we have is each individual billing clerk is accountable for the physician they are handling for that particular day. Our internal process is to make sure we have documentation to record that everything is correct. We have to make sure we have the documentation to go back on. When the billing comes in, first of all, we have senior billing clerks attach a checklist to each and every submission just to make sure that everything is right. After which, then each individual clerk uses that checklist to verify that the account is right. The name is right, then they're inputting all the correct information, service date, specialties, everything. Everything has to be checked down to the beginning to the very end. Once the clerk has reviewed the checklist and inputted all the data, the clerk now assumes responsibility that they've inputted everything correctly. This is now, they are accountable. This is where accountability comes in. After all that is done, this is then checked again on another level of processing. All the billing process internally and externally is printed on a report. This report generates any errors that have been missed, then once again checked over by a billing clerk before the claims are being submitted to OHIP. So who's accountable? Well, both RMA and the physician. RMA reports to the customer, explains their action, and is answerable if need be. The customer, the physician, has to report to RMA of any pertinent details, explain their actions if the billing doesn't meet the standard or requirements of the Ministry of Health, and they need to be answerable if we need to contact them for any information. They also need to be answerable to the Ministry of Health by all their documentation, but that again is another aspect of this whole process. Both RMA and the customer both have to work together to accomplish their goals. At the end of the fiscal year, we provide the physician with an annual summary report that will show them that they have done their job by meeting the expectations of their department. And if they exceed their salary cap, then we have done our job to make sure that patient care is optimized. I know we don't have a hand in healthcare or patient care, but I feel that if we increase and maximize the revenue of our physicians, they are then getting the means to feed their department, which then feeds the patients and so on and so forth, happy families. That's I feel like it's a line. It's a line. So that's my example of accountability at RMA. I hope that makes some sense, and I hope you enjoyed. Okay, thank you. Bye.